So here we have Dr. ABD, who's the Chief Surgeon at Magbenteh Hospital. Dr. ABD, what are the main procedures that you do here in the hospital?
The commonest procedure are hernias, followed by a cesarean section. Then we have acute abdomen, either due to gastric perforation or typhoid perforations. And sometimes we have people coming with bands and adhesions, which we have to release. And apart from that, we do a lot of appendectomies. We also do prolapsed uteruses. We end up doing hysterectomies. We have a patient with myomas. We do, when they are not too big or too complicated, we do myomectomies. And we do a lot of tropical ulcer management. We do skin grafting, wound care. We do a little bit of orthopedic procedures. People with fractures, we do close reduction, we apply POPs. Unfortunately, we cannot fix screws and plates because we don't have the equipment and the drills. This makes it very, very difficult. And like today, I did a cleanup on a patient. I did one hernia. I did somebody with a pleural effusion, and I did a thoracentesis. And I drained 2,200 mils of sanctochromic fluid. This lady's condition was so bad. We have to improvise, like what I did for this woman, because we don't have the underwater steel drainage bottles, which we need very badly because almost every month you have to drain 2 or 3 chests, usually due to tuberculosis, and you need an underwater steel drainage system, which we don't have at all. It's of great need. Basically, these are the few things we do. We don't do anything like ophthalmology here. There are lots of patients out in the community that needs eye surgery, but we don't have those facilities. We need somebody specialized in trauma surgery because we have a lot of cases coming in with trauma, and we need just somebody in that area.
From a lot of the motorbikes and things, yes.
I mean, there are just too many motorbike accidents and people breaking their legs or limbs, needing immediate medical care. Unfortunately, we cannot do much in that area. These are just great needs.
And you mentioned C-sections. Are a lot of those elective or are they planned because the women have had, say, female circumcision and things? I know that's a lot in your culture here.
Unfortunately, let me be honest with you. For one whole month, you may do only one elective CS. All the rest are emergency cases. All the rest are emergency cases. Since the beginning of this month, I think we've done over 16 CS, and only one was elective, and that's we did 2 days ago. The rest of the patients came in as emergency due to obstructed labor, fetal distress. They are referred from other hospitals where they have tried and they couldn't succeed. Then they ended up here. Like 4 days ago, I had to do a lady with a ruptured uterus. She was referred from another hospital. This lady had a very poor obstetric history. This case was, this time around, it was her 5th pregnancy. You can't believe it. She also lost that baby. She had a ruptured uterus. And we felt so bad. Everybody was, shocked because she never had a baby. She lost 5 children, all because of delays and other things. Well, I managed to repair her uterus instead of doing a hysterectomy to see the possibility of helping her in the future to have a baby.
And do you have a lot of problems with genital urinary fistulas here?
Yeah, for sure. There was a time we had a lot of vaginal fistulas due to delays and some home deliveries. Interestingly, there is an organization in Freetown who are handling today all these fistula cases. And I don't do fistula cases anymore because there is a specialized unit that is handling them. So each time I see a patient here with a fistula, we refer them to the fistula clinic in Freetown.
Okay. And if people were to donate medical equipment here, what would you specifically need for surgery? And what do you feel your surgeries are limited by? What would you like to have more of or more available to you?
Yeah, definitely. One of the things we need most urgently is our anesthetic system. Today we depend barely on ketamine and regional block, that is spinal anesthesia. And there are certain times you find it very, very difficult to do other operations because of the anesthetic methods. And the worst is, when you have to do big hernias in small children, and you have to fix maybe a typhoid perforation on a small kid, then you place them on ketamine, they are not relaxed, they fight a lot. So we need proper anesthesia. We need proper anesthetic machines that are functional. It's sad to say that we have a unit that is donated, but this is junk. And this is very sad. Somebody donated an anesthetic machine, the old set is here, but it is incomplete, it is not functional. So if people are donating things, let them make sure that these donations, what come in here, they are functional equipment.
Because it's expensive for you to get rid of junk equipment.
Exactly, then. Exactly. It is very expensive. And also, if you look here, we have a SEAC that is standing here. You tested it and it was shocking you already because it is not functioning. If I have a SEAC that is functional, I should be able to fix most of these fractures with proper controls as I do these operations. And we need equipment. Our surgical equipment are very old now. Let me tell you, I'm using equipment that I've been using for the past 10, 15 years. And some of the needle holders are no longer good. Some of the forceps are no longer functioning properly. So we need an old set of sets, for laparotomy, for hernias, for C-sections, orthopedic surgery, for things like gallbladder resections, and, for bowel surgery, name them, for hysterectomy specifically, So we need an whole lot of instruments because the stuff we have, they were donated a long time ago, and some of them have really worn out.
And for volunteers that were thinking of coming, is it just medics and nurses? Can everyone contribute? And what in particular do you like to get help with?
Well, we appreciate volunteers coming. For sure, non-medical people can come here. The main problem we have, if you look at the hospital, it needs to be renovated. And but where is the money? You need money to do the renovation. So if people who can paint say, okay, we will come and we'll buy paints to do the paints, like what you did for the X-ray room. It was not renovated for many years. You came in, you have it nicely painted. It looks so beautiful. So if non-medics could come and say, okay, we are just going to spend 2 weeks here and repaint this old hospital, that will be wonderful. Okay, there are other things, people to come around and even just do teaching to our staff, okay, on basic hygiene, on how to do proper cleaning, and how to keep proper records for the hospital. You need an old range of people to come around and really help see that this beautiful hospital will continue to provide the services that it is intended for.
So you're saying as long as someone is willing to work, they have something to contribute?
There is something to do here, sure. As long as somebody is willing to work, there is something to do.
Excellent. Thank you very much, Dr. Abdi. Is there anything else you'd like to say?
Well, we need help. We need help. We are doing a lot to help this hospital. It's a lot of sacrifice. For me, as a Sierra Leonean, I'm obliged to be here, to work for my country, to work for my people. But sometimes you are frustrated because the things you want to work with, they are not available. And sometimes you even need somebody to help you, but you don't have anybody to turn to. And I invite some specialists to come and pay a visit. If they come, I can learn a lot from them and impart knowledge to me so that I will continue helping the people here. And I think that is what we need. I remember a few years back, a urologist came for 3 weeks and he taught me how to do prostatectomies. Within 3 weeks, today I'm doing all the prostates around. And that is just a big blessing for the people. This is exactly what we need, skills, to help us gain more skills, to be more efficient, to make sure that this hospital continues to be more functional, more reliable, and more creditworthy. And it's not only me, but also for the rest of the other staffs that are working here, that are committed, that needs to be educated. I mean, we need further training. We need support to keep this hospital running.
Excellent. Thank you very much.
Thank you.